Good morning, good afternoon. Welcome to today's presentation, Unlocking Nurse Retention Success, Strategies for Internationally Educated Nurses. Before we begin our presentation today, we would like to begin with an acknowledgement that N4 is hosted at CHEO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin and Anishinaabe territory. The peoples of the Algonquin and Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples, and their valuable past and present contributions to this land. My name is Colleen Drake. I am N4's Project Engagement Coordinator, and I will be hosting and moderating today's presentation with my colleague and co-host Andrew Tomeyer, Education Coordinator, who will be behind the scenes monitoring the Q&A box today. I am now pleased to introduce you to today's presenters, and I'm going to ask that you turn on your video as I introduce you. Dr. Lee Chapman is committed to advancing the nursing profession in Canada to ensure equitable access to quality care. As CNO for Canada, she provides strategic advice to Health Canada, plays a convening role on key nursing issues, and represents the federal government on public forums. Lee is a registered nurse and received her PhD from the University of Toronto's Lawrence S. Bloomberg Faculty of Nursing. Over the past 20 years, she has gained a deep understanding of nursing by working in both frontline and clinical leadership capacities. In addition to her role as CNO for Canada, Lee continues to work at a community-based consumption and treatment site in Toronto, where she provides harm reduction services and frontline care. Welcome, Lee. Christine Curry is the National Newcomer Navigation Network's Director. Christine's 30-year career in healthcare has focused on identifying inequities and addressing key barriers through measurable and sustainable change. She holds a Bachelor of Science in Nursing and a Master's in Health Administration. Her work to ensure equity for Syrian refugees led to a passion for raising awareness of the barriers faced by newcomers within the healthcare sector. She co-designed the formation of N4 to enhance the capacity of healthcare professionals in assuring equity for newcomers through knowledge mobilization and pan-Canadian and intersectoral collaborations. In addition to providing leadership to the N4 team, Christine continues to lead CHEO's health equity efforts for their most valuable patients and families, including newcomers. Welcome, Christine. Welcome to you both. I just have a few other housekeeping slides to jump through, so bear with me for just one moment. I will note that our speakers do not have any conflict of interest to declare. The recording will be available today following our presentation. The participant experience, you have the option of asking questions in the Q&A box, and you have the option of upvoting these questions. Please do so as you wish. I am also pleased to let you know that today's presentation is CCHL accredited, so members of the Canadian College of Health Leaders will be able to get credits from attending today's presentation. I'll just stop sharing our presentation, and I'm very pleased to hand this over to Lee Chapman.
Thank you so much. Thanks, Colleen and the N4 team, and bonjour tout le monde. I'm absolutely delighted to be joining you. I'm joining you from Treaty 13 territory here in Toronto, which is the traditional lands of the Haudenosaunee, the Huron-Wendat, and many diverse Inuit and First Nations peoples. I'm delighted to share a little bit about my role and mandate as it relates to internationally educated nurses. So if we can go to the next slide, please. Thank you. Just a bit of an orientation to the discussion today, and certainly invite questions from you and comments. I'm going to provide a bit of a background on my role sort of and mandate, and then talk about the nursing retention toolkit and really zeroing in on strategies that are specific to internationally educated nurses. We'll go to the next slide, please. Okay, so just to situate us, my lens is always nursing as the Chief Nursing Officer for Canada. And so when we think about the regulated health workforce in Canada, it's very vast and interprofessional. And so there's unique features when we think about our regulated health workforce. And when we talk about regulation, it means that our regulated health workforce has a legislated scope of practice that is determined at the provincial and territorial level, a mandatory education requirement, also determined at the provincial and territorial level, as well as professional standards for practice and professional conduct process. Also within that is often a quality assurance process or continuing competence mechanism. Again, all specific to the 10 provinces and 3 territories in our federated nation. So when we look at nursing in particular, nursing is the largest group of regulated health professionals in Canada. And that's across the 4 different categories of nurse, from licensed practical nurses, registered psychiatric nurses, to nurse practitioners. So across all 4 categories, nursing is the largest number of regulated health professionals. But we also have to think about the nursing role in being very proximal to the point of care and having a key, broad, holistic and systems perspective in terms of the work that we do as nurses. So we'll go to the next slide, please. In terms of the role of the Federal Chief Nursing Officer, I think it's just important to note that this is a role that's existed in Canada since the late 60s. It was then eliminated in 2011 under Harper's Deficit Action Reduction Plan and reinstated in August of 2022 by the former Minister Jean-Yves Duclos, who said that the role was about recognizing the important contribution of nurses and increasing the visibility and input of nurses in decisions at the federal level. And in terms of what Minister Duclos said when I was appointed into the role, he talked about the crucial role that I would play in stabilizing the nursing workforce by ensuring the perspective of nurses is included at the national level. And so this is essentially a key, these are my marching orders. This is a key part of my mandate and my priority in working with folks from across the country to ensure that we're actually able to support our health systems with robust nursing health workforce planning. And certainly that's a key part of my role from the federal perspective. So we'll go to the next slide, please. So I won't hover too much on this. I think a lot of this is available on the Canada.ca website, but just wanted to mention that I have worked in a variety of sectors. I've been a nurse now for 21 years in Ontario, just over 21 years in Ontario. Started my career in critical care and, as mentioned, continue to work in a community-based setting, and have also worked in home and community and camp nursing in a variety of different settings. And one thing that I wanted to mention as well is that I have been an examiner for internationally educated nurses for over a decade. So really, am keenly interested in, ensuring the efficient integration of internationally educated nurses into our Canadian workforce, not just because of my background, but because that's a key part of my role and priorities. We'll go to the next slide, please. So what is the role of the Federal Chief Nursing Officer? So primarily, my role is about providing strategic advice from a health policy perspective within the strategic policy branch or the policy branch of Health Canada. And so lots of really interesting work that occurs there, a lot of health workforce health human resource planning, and so on that happens. And that's what I've been very intimately involved in. Federally, as you know, likely that we fund healthcare from a federal perspective. We had a record investment in healthcare last year of over $200 billion. And so our role is that of a convener. How healthcare is organized, managed, and delivered is really up to the provinces and territories. And so that means that our role from a federal perspective is that of a convener in bringing all of the various players together. And then I represent the government both within Canada and internationally. And I will say that most of my work has been domestic, but I have done some work in the region of the Americas with the Pan American Health Organization, and was just in Geneva in May for the World Health Assembly. And I can say that the topic of nurse migration was a major, major topic that came up, not just at the World Health Assembly of the World Health Organization, but also at a meeting that was convened by the International Council of Nurses in collaboration with the World Health Organization. So we'll go to the next slide, please. So in terms of what I've been up to since I was appointed into the role, this slide really summarizes it's almost 2 years now since I've been in this role. And I've really prioritized engagement with nurses across the country to really understand the everyday frontline point of care realities, and really try to appreciate the issues that are important to nurses. So I have been, you can imagine the nursing community in Canada is very vast. When we think of all of the different players, there's nursing students, there's faculty members, clinical preceptors, there's administrators, educators, nurse executives, point of care nurses, union representatives, professional associations, and lots of vast differences when we think of the different sectors in which nurses work, the different areas of specialization. So we have almost 470,000 nurses in Canada. So a very, very large nursing community, again, across those four categories of licensure or registration. So federally, we have the Principal Nursing Advisors Task Force, which is an important committee, a federal, provincial, and territorial committee. And our role there is to come together monthly and talk about all of the relevant nursing issues across the country. This group is comprised of all of the government chief nursing officers or equivalent from every province and territory. Federally, we also have a very large nursing workforce when we think of the nurses who work in the federal departments, for example, Correctional Services Canada, Veterans Affairs Canada, Indigenous Services Canada, the Public Health Agency of Canada, ESDC, and the Canadian Armed Forces, and so on. And everything is quite different if we think about the union, the HR requirements, even the job classifications are quite different within the federal departments. And the work is quite different across those different departments. So we come together as well and talk about issues that are common within the federal departments. I have really prioritized engagement, as mentioned, in all provinces and territories. Was able to get to every province and territory by January of this year. And again, have really, really wanted to meet with internationally educated nurses, frontline nurses, nursing students, faculty members, and all kinds of different players across different settings and sectors as well, going from acute care to public health, community, and long-term care, and so on. And in all of that work, it's been very clear to me that there is a lot of focus on nursing recruitment, much less focus on nursing retention. And that really led to the development of the Nursing Retention Forum and subsequently the Nursing Retention Toolkit. So I'm going to talk a little bit about that in the next slide, please. So we brought nurses together. Initially, we brought an advisory committee together last February, and then we brought nurses together in a large pan-Canadian nursing retention forum last June. And the goal of the forum was really to co-develop this nursing retention toolkit. So we had an idea of these 8 color-coded themes that you see in the wheel. We had an idea of the values that you see that are underpinning the themes in the center. So you see the values of respect, transparency, anti-racism, anti-oppression, and accountability in the innermost circle. But really, the goal of the forum was for nurses to come together and help co-develop the toolkit. And we think that these are themes that impact nurses' day-to-day working life, primarily in the domain of clinical care. And then we have provided corresponding tools that employers or health authorities can use to really improve the working lives of nurses in Canada. And this is a really important point, that these are not strategies that are aimed at the individual nurse to improve their personal resilience or to reduce their burnout. These are things that are really aimed at the organizational or structural level. We do provide a link to the toolkit you see here on the canada.ca website, and it is available in both official languages. We'll go to the next slide, please. Thank you. So the toolkit itself was certainly created in the context of interdisciplinary team-based care, which is the world we all live in terms of our collaboration with other health professionals and health and social services, but very much created as an initiative that's by and for nurses. And I think the forum participants felt very strongly that this was a uni-professional initiative, not that it doesn't have broad applicability to other health disciplines or health professions, but this was something that nurses wanted to create for themselves. So again, you see the 8 color-coded themes. You can see the goal statement for each of the themes, and then you can see 3 initiatives for all of the themes with the exception of safe staffing practices, which just has the 2 initiatives. So I would say, if I were to pick 3 themes from here that I would say are getting a lot of attention, I would say it's probably safe staffing practices that you see there at the end. Again, these are not in any particular order. That's why we depicted them previously in the wheel in the round circular format. But safe staffing practices is definitely getting a lot of attention because we have seen safe staffing initiatives come up in BC in collaboration with the BC government and nurses union, as well as in Nova Scotia. And so really are interested in seeing how this plays out across the country in those jurisdictions. Reduced administrative burden is also getting a lot of attention, I would say, in terms of ensuring that we actually redesign the work environment to really optimize nurses' work and nurses' role, that we have digital preparedness, and that we also have documentation requirements that aren't overly burdensome for nurses, that they're congruent with regulatory requirements. And then I would say as well, flexible and balanced ways of working is also getting a lot of attention. I think that the COVID-19 pandemic really encouraged a re-evaluation of how we balance work and life, and nurses want this flexibility and balance as well, in terms of the way that their work is designed, how scheduling systems are managed and how they're automated or not, but then also ensuring that nurses have workplace resources and amenities. So I will go to the next slide, please, which just does hover on the theme of professional development and mentorship, which I think has a lot of relevance for internationally educated health professionals. So if we can just go to the next slide, please. Thank you. So under professional development and mentorship, I wanted to focus on this because I think it is something that we often take for granted. We think, organizations will have robust professional development and mentorship programs, or this will exist at some professional level, but these are often things that are often lacking funding. It's often very difficult to find these opportunities. I think it speaks volumes that this webinar itself by N4 has been accredited by the Canadian College of Health Leaders, because that's a wonderful organization to collaborate with for professional development opportunities, especially leadership development opportunities. So when we look at this theme in its entirety, the theme is really about providing nurses across the entire career span options to enhance their skills and pursue their career goals. And I will say that during the retention forum, there was a real concerted effort by forum participants to ensure that we were inclusive of internationally educated health professionals in these career laddering and bridging opportunities that often, because of the journey get to seek licensure and to get that initial registration is so difficult in some circumstances. We sort of think that the journey ends there, but we know that our internationally educated nurse colleagues who are coming from other jurisdictions, other countries, bring a wealth of expertise that actually really benefits our health systems across the country. And we need to provide opportunities for them, not just for initial licensure and registration, but also beyond. So we've highlighted a couple of examples here. These are not exhaustive. There's more resources and examples in the actual toolkit. And this is really evergreen. We hope that we can continue to update as these best practices are happening across the country. So we highlighted the niche program in Nova Scotia. This was a program that did receive some federal support, and it was really around transition programs for internationally educated health professionals by ensuring that there's support, education training, as well as supervision. And we've seen supervision emerge in several jurisdictions in terms of supervised practice experience programs, which are very popular and have proven to be very successful. Under mentorship programs, we highlight Ontario's Clinical Scholar Program and know that this is not specifically for internationally educated health professionals, but also to help with the transition for new graduates. But this is where an experienced nurse is paired with as a mentor with either a new grad or an IEN or nurses wanting to upskill and ensure that that support is available. And I have to say, I've met clinical scholars and I've also met those who have benefited from the clinical scholarship mentorship and mentoring relationship. And it's exactly what's needed to effectively support nurses as they enter into practice. We know that retention actually starts in nursing education programs. We need to ensure that nursing students have quality placements so that they are retained through to graduating from their programs and then transition into the profession very successfully as well. So retention is critical at all stages. It's not just a phenomenon that we need to look at for mid-career or experienced nurses. It's really across the board. And then we highlight career pathways and bridging programs. There's many. We highlight the Vancouver Community College Advanced Entry Program, but I would say that bridging programs and the career pathways, career laddering opportunities are very, very popular. And it's a wonderful opportunity to really scaffold your learning, to build on your learning and look at how to advance yourself professionally and while you're continuing to work, often with licensure in a health profession as you're continuing your education. So again, just a couple of examples of transition programs, mentorship programs, and then career pathways and bridging. There's more examples in the toolkit, but I think it's really important to think about ensuring that internationally educated nurses are included in these opportunities because they have such a vital perspective that can enhance our health systems across the country. Okay, so we'll go to the next slide, please. So under this example, we just highlighted, we have a quote here from Cynthia Baker, who's the Executive Director of the Canadian Association Schools of Nursing. And one of the things that Cynthia mentions is the residency program. And this is again about that transition support. We had provided some federal funding initially for the residency program for new grads. To really help with that preceptor development and transition to practice. And the program was recently expanded to include internationally educated nurses to ensure that professional development is available. And when we look at this initiative specifically under career pathways and bridging programs, you can see internationally educated nurses are mentioned specifically. So this is when we look at the intended outcome, it's about increased opportunities for IENs who have experience or interest in education, research, and policy, so they're better able to utilize and apply their diverse skills in the Canadian health care system. And I think this is something that we really need to lean into because, as mentioned, our internationally educated nurse colleagues bring a wealth of expertise that can only serve to enhance our health systems across the country, if they are utilized effectively, if they are engaged effectively. And I think one of the strategies is through career pathways and bridging. Okay, we'll go to the next slide, please. So just wanted, I know this is a very busy slide, but I will break it all down for you. These are our shared commitments that were made at the federal, provincial, and territorial health ministers meeting last October. So the ministers meet more than just once a year, but once a year it's a big in-person meeting, and these are our shared commitments. So I wanted to highlight these other things that are really important, in addition to the work that I mentioned on nursing retention. These are other commitments that have been made and things that we're all really working towards across the country. So I mentioned retention. We did release the executive summary of the toolkit just prior to the health ministers meeting, so that we could get their endorsement and support. And the ministers also agreed to reduce rates of stress and burnout, improve workplace culture, flexibility, and wellness, so health workers can stay in their jobs. And part of this is with the over 200 billion that I mentioned last year in federal funding for health. So some of this was in the bilateral agreements that were signed with the provinces and territories. But we're also really keenly interested in how provinces and territories, employers and health authorities are taking up the nursing retention toolkit, how they're implementing it across the country. Because there's no standardized approach. Every organization is doing it in a different way. And we're really interested in learning some of those stories and learning about how it's being implemented. We are also undertaking a domestic education supply and demand study. This was across 5 key health professions from medicine, nursing, PT, OT, and pharmacy. And this was really about looking at our domestic supply of health professionals in Canada, but also looking at it from an Indigenous perspective, because we know that Indigenous people are generally underrepresented in our health professions. And so really looking at this from an education supply and demand perspective. We are also looking very closely at foreign credential recognition and ethical recruitment. We also saw foreign credential recognition come up in the budget that was announced a few months ago, but ensuring that Canada is a country of choice for those who choose to come and work and live and play in Canada. But we know that we need to reduce the time it takes for internationally educated health professionals to join our workforce. So there's a number of things that we are doing when it comes to foreign credential recognition. From a nursing perspective, we're very interested in the jurisdictions that have approved countries, as well as the language requirements and the time it takes for a licensure or registration in particular jurisdictions. We're also very interested in labor mobility. I think COVID really showed us how care transcends borders with the emergence of virtual care. And we know that we have a very nimble and agile workforce, and we need to ensure that we're able to support that mobility of our workforce across the country. And then health workforce data and planning. This is a key priority of this government, ensuring that we actually have better health workforce data so that we're able to do supply and demand projections. So some of that is in the establishment of Health Workforce Canada that was established last December, but really ensuring that CIHI, Health Canada, Health Workforce Canada are all working very closely together to look at the workforce data and planning. Okay, so we'll go to the last slide, please. And I just want to really thank you and recognize that I can't do this role without collaboration with the nursing community. So I really want to thank nurses across the country who I've had an opportunity to meet with, who have asked critical questions and provided feedback, and really have been engaged in finding proactive, positive solutions to uplift our profession despite the workforce challenges that we currently face. I want to thank N4 as well for their steadfast commitment to navigation supports for internationally educated health professionals, and for the opportunity to collaboratively provide this webinar. It's been a wonderful collaboration with N4, so thank you to Christine, Colleen, Andrew, and Sahar. And I welcome any questions or in discussion. So merci beaucoup. Thanks very much.
Thank you so much, Dr. Chapman. So I will stop sharing your presentation, and I'm very pleased to hand off the speaker podium to our director at N4, Christine Curry. And please, audience, keep your questions coming. We will have some time to address those to Dr. Chapman and to Christine Curry at the end of the presentation. Thank you so much.
Thanks, Colleen, and I'm making sure that you can see my slides. I'm assuming so.
Success.
So, okay, perfect. Thank you. And thank you, Lee, for that great talk. I always learn something. As fellow nurses, we always learn from each other every time we hear each other speak. So wonderful. And so much resonated for me. I began my nursing career, as Colleen said, more than 30 years ago. And some of these issues, oh my gosh, that workload, we were talking about that when I was a new nurse. So being wonderful to solve that. Just a bit of a reminder for those who aren't aware that N4 actually has a dual mandate. So yes, absolutely, we look at optimal employment of internationally educated health professionals, and we have another mandate around health equity of newcomers who are patients or clients within the health space. Today, I'm going to focus obviously on IENs and that work. So just briefly, we have just short of 2,200 members from across Canada. I encourage you to become a member. Membership is free, and you'll find we attempt to be a one-stop shop for everything related to newcomer equity and that interaction or intersection with health. So we began this work, we were asked by IRCC to look at specifically nurses and physicians as a beginning point and the suboptimal employment that they have. So our statistics currently are pretty dismal. We do a great job of recruiting and accepting nurses and physicians. We know we have an HHR crisis, and so they score highly for immigration. Our problem is that there's a disconnect between immigration and then becoming licensed and working in Canada, as Lee said about that foreign credential recognition. So right now, less than half of nurses are successful in transitioning their credentials, despite being accepted because of their credentials by immigration. So there's that disconnect. And so I'm going to talk to you today about certainly how do we improve those stats, but strategies around how to retain IENs. Really, as Lee said, retention starts at the beginning and goes all the way through your career. So it's not something you just, okay, now they're here and what do we do? There is that preparatory work that's organizations that we can do. So, and why is this important? Well, 1 in 3 nurses approximately were born outside Canada. Now, some were educated within Canada, but we also have a lot who work in the healthcare force. We have estimated 52,000 vacancies within RNs and LPN roles. And yet our census of 2021 shows that there are actually 61,000 IENs who are dying to fill those positions, but are just struggling. About a third of those have been here less than 5 years, so their recency of practice is still active. And so they're poised, if we can leverage them for those roles. What CHEO did is we formed, in order to address this issue, we have a community of practice model, which has time-limited working groups. And so we formed an IEN working group, and as well involved, we're very keen to do everything we do at N4. We do a co-design model with those with lived experience. So we also had an IEN consulting groups. As well, we formed an employer consultation project. As soon as our funding was announced, we found a lot of employers were knocking at us door saying, we need nurses, help me find nurses. How are you going to help me find a nurse? So we quickly also adapted to have some employer tools, which I'm going to discuss today. So we had our IEN working group, as I mentioned. You'll see the logos of those who have participated. They are continuing. We anticipated a short 6-meeting endeavor to get a recommendation report. They've chosen actually to continue to work together on a quarterly basis because they're so committed to advancing the recommendations that they form. So it's a wonderful group. In addition to that working group, we have partners to advance the IEN recommendations. Of course, our Lee and her office are one of those, but you'll see the other person that's quite broad as well. So we formed some recommendation reports just to say, we have those if you're interested, they're on our website. They form part of our internationally educated health professional resource hub. One was specific around IENs and how can we change the status quo. We also formed a report for employers. What are the tips and tools? And we sought out best practices or promising practices across Canada that would help employers really leverage IENs in their workforce. And so I'm going to cover a bit of that, but I'm also going to cover what we did additionally to make it really user-friendly is we did an employer checklist for employers. So a really check-off list of, do I have everything in place in terms of a system level to help recruit, onboard, and retain IENs. So our first step that we have in there is really, and many hospitals and other health employers are starting to do this, but do you have that data when you collect data about who are your employees? What is our workforce made up of? Also make sure that you include, were they born outside of Canada? Because that does impact, that's wonderful celebration of the diversity. A third of Canadians were born outside of Canada. So in fact, your workforce should be about a third of people as well. So if a third of your workforce weren't born outside of Canada, there's something wrong in your representation that you should be thinking about recruitment. And then in order to capture who are your IENs, you'll want to know who has degrees from outside of Canada. So that will target you around your underemployed, and there's nurses, you know, I saw your stats, Lee, around pharmacists, OTs, PTs, they're mental health providers that are probably hidden in plain sight. And that's what we heard amongst those that we consulted with that are IENs. A lot of them were working very underemployed, but within the health. Their passion is for health. So even though they were challenged around becoming an LPN or an RPN, they were working in environmental services, they were healthcare aides, or even other roles in the hospital. Become a member of your local immigration partnership table. Why? Because you're going to know what the stresses are and preventions that exist for your IENs in becoming employed. So you'll be at a table with your settlement organizations, the people that are on housing, schools, the police forces are there, childcare is there, immigration is at that table. It'll give you a sense of your patients, but also your staff who are newcomers and what are the challenges you're facing. Equity, diversity, and strategy. I think most organizations have now developed this. But I challenge you to not just have a token policy. Everybody has their anti-discrimination policy. I challenge you to look at what are your practices to not only address incidences of bias or clear out racism, but to also understand what are the experiences. How are you going to proactively solicit? Let's not wait for a large complaint where somebody's out the door and saying, you know what, I can't stand it anymore, I'm leaving, and they pass on this complaint on their way out. And how are you going to address experiences of discrimination in a fulsome way? So what you will hear from those, I would say this from anybody who's in a minority population, but particularly IENs, will not come forward with formal complaints. If you're waiting for that, you won't hear about them. You'll just see them leaving. So what's your support for a staff to get that just-in-time support for, I had this awkward experience where I felt like this was because I was an IEN, either with a patient or a colleague, and how can you support them informally rather than a super formalized process, which is very intimidating to anybody, much less an IEN who has immigrated to Canada, may have permanent residency and not citizenship yet. They feel super vulnerable. And then form a communication strategy, which expresses to your whole organization and in particular to IENs that we welcome diversity in our workforce. We welcome IENs. Having feature articles about IENs that you have employed is super hopeful and gives confidence to those IENs who are hidden in plain sight. And then you'll also want to say how you can help them, and which I'll get to next. So how do we leverage Canada's IENs? Again, those employee profiles will help you find those who are in Canada less than 5 years in particular. You know, they have recency of practice, they have a nursing degree, and then you could see that they're not working as an RN or as an LPN. Others have gone very old school, posting flyers, your newsletter of your organization, putting out the word that, hey, we're willing and happy to support you towards becoming an IEN, and letting them know it's not just IENs in your community. Communities tend to stay very close knit. So most IENs either come from India or Philippines. They tend to be very close knit communities, and they'll spread the word that, this is a hospital or a healthcare organization who welcomes us, and that will help you as well. Let your lip when the local immigration partnership table, you can let them know as well of your efforts. And some have gone to the local press and said, hey, here's what we're doing. And we'd love to hear from others. So it's another way to let them know that you're a welcoming organization to onboard IENs. So once you have IENs, I hear people are nervous. I'm like, okay, but what if they come forward? What do I tell them and they don't have a license? So you have the resources. The N4 IHP Hub and its elements are there to support you. The other thing I want to highlight, some organizations have thought about international recruitment. As you saw those stats, we have enough in Canada. We are really at N4 advocating to stop international recruitment efforts. There are enough already in Canada and who voluntarily hear about Canada and want to come. We are a very welcoming country. We have problems for sure on foreign credential recognition, but we have enough naturally flowing in without these international recruitments, is our opinion. And then you want to think about fair and unbiased interviews once you're going to onboard. So how do you do that? We have a webinar on our site that you can reference that really gives tangible advice from an expert on how to conduct unbiased interviews. So I'll just highlight so you know what the IHP hub that we have has, that one-stop shop for you in terms of IEN supports. So we have a visual pathway, which I'll go through in a minute. The rest of those on the right, 6 boxes are things that we have curated across Canada that are either programming or best and promising practices for you to learn about. So every province has been trying different things around IENs, and the federal government as well. So everything that is special funding in your province, you'll find it listed by province and then by profession. So you can look up, nurse, Ontario, and here's all the different options they have. So if you have an IEN says, yes, I'm an IEN, I want to become a nurse, I already work at your organization, so they've adapted to your culture, they fit in, and you'd love to be IEN. Those are going to be people you are going to retain forever if you help them. I'm telling you, they'll feel so indebted to your organization. So let them know about this hub, maybe help them guide them through it first. So if you become familiar, you'll be able to say, oh, look, here's provincial initiatives. And look, you could get in Ontario, you could get your application fees reimbursed. And here's the link to where it is. Bridging programs are there as an FYI. Bridging programs happen after the colleges evaluate them, but we want them to know about them. And it gives a caveat there to say, please don't sign up. Your college will let you, because we found IENs struggling and trying to sign up for bridging programs that they might not even need. And in pretty much almost every province, there is a designated navigational support for IENs. So for instance, BC, Health Match BC, they call them, they will walk them through the process. Lee talked about the niche program in Nova Scotia, Ontario Health Workforce, our own Ontario Health Workforce. So every province will have that hand-to-hand support. So employers don't need to think about, oh, I need to figure this out and do it with them. Some have gone the extra mile and done that, like Sunnybrook, but that's resource intensive. You don't need to do that. You can rely on those provincial navigators who are already paid, they're free, etc. You may hear from IENs that they are thinking of moving because, housing issues, childcare issues, the children, they're not sure about schooling issues, etc. Those are all settlement issues, and there are paid federal employees who are there to help newcomers figure out those different things, transportation, all those different challenges. So there's a site, and they just have to put in their postal code, and it'll give them all the different settlement supports that are available. So, it's one way of encouraging them. They may be thinking about leaving your organization because they can't figure out whatever is at the, oops, sorry, I'm getting an alert. Their spouse may be needing a job and they can't figure it out. They'll help their spouse find a job as well. So please think about that. Non-clinical supports are those skills that maybe their clinical skills are usually fabulous in IENs, but it's those non-clinical skills, that adaptation. And so there's some programming there that they can avail themselves of. And I'll highlight our offer in a minute. And then there's employment information. So we do have, as Lee said, really scattered approach. So for instance, in PEI, to be a nurse, you need to apply to that central PEI health. In Ontario, you apply to each organization as you see fit and where you see a fit. Every province is different, so we have the employment information there. The visual pathway that we developed for IENs will show them in a very visual form, and it's got hyperlinks when it's downloaded on how to become credentialed in Canada. So it goes through each step by step. And so encourage you to give that to IENs who approach you about becoming licensed. The other program that we have is for non-clinical skills, and enrollment is actually open right now for our 7th and 8th cohorts, which are beginning in September. And so it's offered in both official languages, which is wonderful. It's the only French program that we're aware of across Canada. And again, it's that non-clinical skills. So if I'm an IEN and I'm trying to adapt, and you're trying to, maybe they're struggling and they are licensed in your organization, this is something a course they can take. It's 12 weeks online, about 2 to 4 hours per week. And it teaches them about what are the communication styles we have in Canada? What are the reporting systems like? In the Philippines and India, nurses would be reporting to physicians and very reliant on their direction. That's definitely not our system in Canada, as I'm sure anybody who's a nurse, and Lee and I will say, we're independent practitioners, right, as nurses. And so physicians rely on us as more of a colleague. So learning those kind of skills, those communication styles that they need, how do you adapt to different communication? They're going to see much more diversity in Canadians' patients than they would see in their country of origin. So it talks about things like that. Indigenous health. What is Indigenous health? What's our commitment to this? What are land acknowledgements? Why do we talk about those? And getting them used to understanding and how to have a respectful and really supportive relationship with their Indigenous patients. So I encourage you to refer any IENs you have to that, and you can certainly reach out to us for more information. Step 3 is around the onboarding of IENs. What I've said here is that they're equal but different. So IENs tend to arrive with years and years of clinical experience, which is fabulous. They arrive with diversity, which we need, and we need to show our communities we represent them. But there's those differences you're going to have versus a new grad versus an IN as you onboard them to your organization. So there are cultural differences, as I said, that relationship. How does your team work? Who's on your teams in your organization, right? In pediatrics, there are child life workers. What are those? When do you refer to them? And so kind of thing. Your new grads would have gone through the system and heard about that. They would never have heard about that. Really focusing on things like patient expectations on shared decision making. We're a very individualistic society in Canada where patients expect to drive their care, and we want them to do that. But that may be very different to another culture where it's very hierarchical, and they would rely on the physician to give instructions and just follow. So they need probably some coaching around that. And then again, how are they to report any bias or racism? I just read one of the college's annual reports, and they included them there, and I applaud them that they had a quote from a nurse who observed an IEN experiencing racism and how she struggled as a nurse to say, well, what's my role in that? So the IENs and your regular nurses should know what is our practice, how can we support each other. Mentorship is really important for IENs, and Leah talked about some initiatives that they've supported at federally, and there are some provincial initiatives as well. So having a clinical position dedicated to them to be that just-in-time support is super helpful. A lot of IENs themselves are interested in paying back, or for the supports they got, or improving on the supports they didn't get. Certainly, one way to do that is to survey your staff to see of the nurses who's interested in doing that. There are government funding and grants available. It's on our website as well. One of the people that we saw that was leveraged by some hospitals really successfully is those who are like, okay, I'm ready to retire, but they'd love to pass on knowledge. They just don't want to do that frontline clinical care. So those are great folks to recruit to those roles, and they're often happy to do, part-time or, more flexible hours. You also need to think about your other staff and having them be an accepting environment. We heard a lot about experiences of bias amongst the IENs, and one of them said, "You don't realize how much we suffer in silence." And so, of course, we don't want that. That's definitely part of your retention, is to make sure that they feel like they're welcomed. And so having staff communications and within your orientation of expressing your commitment towards diversity, which includes people who are trained in other countries, and how that's a value add, and really portraying that as a value add versus a deficit or a risk we need to mitigate, is really important. We definitely mitigate risk with IENs, but we also mitigate a lot of risk with new grads. I will tell you, having been a new grad, like, I had lots of supports around me, and we should do the same for IENs. They're just different. And so focusing on finally the retaining piece, it really encourage your internationally educated health professionals, including IENs, to participate in your EDI resource groups, which hopefully you have, and think about maybe even forming one for internationally educated health professionals. It helps them feel less lonely, less like they're the only one, and having that support is a retention and a great support in terms of their mental health. I mentioned that. Make sure that the IHPs are aware of how to report microaggressions, things that feel uncomfortable, flat out discrimination. They are going to experience racism, if not from your staff, then from their patients. It's happening every day. So we need to stop saying, oh, if it happens. When these things happen, we are so sorry, but when things like that happen, we want to hear from you, and here's what we'll do. And encouraging them to act on each event and feeling heard, giving that space. Really, as you do those things, making sure you don't question. People know when they've experienced discrimination. Let's not saying, well, did you misunderstand? They will not say anything, and they will leave your organization. So really think about those strategies, those listening skills we do with our patients. Let's also use them with our IENs. When you do those staff surveys, let's make sure that we look at their demographics in there, include that in your staff satisfaction surveys, and your exit interviews capture whether they're IEHPs, and look for themes. And then finally, make sure you act on it. Don't just listen. It's important to listen for sure, but think about your mechanism you're going to do to change policies, procedures, practices, and think about training to promote an inclusive and diverse workspace. So that is the end of my presentation. I'll turn it back to Colleen for any questions.
Thank you so much, Christine and Lee. Wonderful to hear from you both and all the work that's being done. We have lots of questions coming in, so we'll dive into those. And for the audience, just so you know, if we don't get to your question today, we will get to those questions. We have Lee and Christine's ears, and we'll make sure that those do not go unanswered. So let's dive right into the questions. So to you, Dr. Chapman, this is great information. From your experience, has there been much discussion regarding IENs starting their nursing careers in home care settings that require working more independently without direct supervision at all times? There's a second piece to that. So the niche is amazing for hospital based. However, there are many challenges home care organizations are facing when successfully integrating IENs into home care settings? And please let me know if you'd like me to repeat any of that.
Yeah, no, thanks so much. I was trying to answer some of them as we were going because there
Fantastic.
were lots of great questions coming in. I think that most programs for integrating internationally educated nurses in particular are in more sort of structured environments, if you will, where there is more direct oversight and there's perhaps nurses have to be extremely autonomous regardless of the setting or context of practice in Canada. And sometimes that is a departure from nursing practice in other countries. And so often the integration tends to work best in those sort of structured environments. But it largely, I would say depends on the experience of the internationally educated nurse. So I don't want to give sort of a blanket statement in saying that they're only integrated into hospital-based environment. It depends on the wealth of experience that the internationally educated nurse brings. I think that we need to think creatively in our workforce crisis. And, often new grads who are domestic graduates in Canada are encouraged to go into the sort of highly structured acute care settings. And that's not always where they'll thrive. So I think we need to think creatively and find opportunities and find integration supports in other settings. But I think for successful integration, the collaborative practice and supervision is probably very helpful. So, ensuring that those supports can be available in that initial transition period is helpful, regardless of the context. So if that's happening in home care environment, ensuring that those supports are available.
Thank you so much, Lee. And I can hear what you're saying about thinking outside the box, thinking of a new creative way to have that work. The next question is, I am curious what resources are available for nurse educators, managers, and local staff to understand how to best support IENs in orienting and integrating in their workplaces.
So I think Christine just provided actually a wealth of supports. So I know the slide deck, I think will be circulated as part of the recording. And so have a look, at all those organizations that are part of N4, all of the great work that N4 is doing. I think those are a great place to start, to be honest. I know also Ruth Lee is online here from Care for Nurses, and there's lots of different organizations across the country that are doing great work, but a great place to start is in that map of Canada slide that Christine showed, but then also the N4 resources.
Thank you, Lee. We greatly appreciate that support of N4's work. Christine, would you like to add anything to that?
No, that's fine. I'm just going in the comments and trying to answer as well. Yeah.
Thank you so much. Yes. Let's see if there's anything else. Perfect. Thank you so much both for this information. Christine, I work at CRN supporting IENs in the hospital setting, specifically SPEP. Do support staff ever attend audit the IHP online program for furthering their understanding?
Oh, we haven't had that. I think Sahar's here and she runs our SPU program. I don't know if she's able to unmute. Maybe not. Oh, yeah. No. Yes.
Yeah.
They're asking you about shadowing and just observing the SPU program.
Yeah, for sure. This is something to thank you for bringing this up, first of all. And definitely, yeah, would be if you can reach out and see if we can do that for sure. It will be a good add to the program for sure. Thank you.
Excellent. And then I have a question. We at Career Paths for skilled immigrants work with IENs and IMGs in British Columbia, and I guess they're just asking for any additional details. Please look at the N4 resources. I'm sure that's where our presenters would be directing you. So please take a chance to do that and become a member of N4. I'll see if we can squeeze in one more question. We're running short on time. So I'll just scan quickly for a short question. thanking you both for the presentation. And their question today is, any pathways for an international medical graduate doctor to register to work as a nurse practitioner? So any thoughts on that question?
Definitely a nurse practitioner is a different degree. You couldn't just transfer, right, Lee? They would need to have a nursing degree, do the NP. So that would be like a career diversion. We do have supports on our site for internationally trained physicians. So I would encourage you to do that. People think I have to redo my residency. That's not true. There are actually 5 different pathways for physicians to gain licensure in Canada. So I'd encourage them to look at our visual pathway for ITPs, internationally trained physicians, or IMGs.
Yeah, and I would agree. The education needs to be in nursing and to become a nurse practitioner. And so it's a different pathway. So I think the IMG resources or internationally trained physician resources would be more fruitful there.
Excellent. Well, thank you so much to both of you for today's presentation, Lee and Christine. And we greatly appreciate the audience for attending us today and taking part. If you did not have an opportunity to attend today's presentation in person, we will be recording this and the presentation will be available on N4's website in our meeting place. We obviously have many resources related to today's presentation, so those will also be available. We do have a survey that will pop up following the presentation, and we do ask for your feedback, so take time to do that. Greatly appreciated. If you haven't had a chance to check out N4's app, please pop on to the Apple or Android versions. And with that, I will hand it back to Lee for any last words, and then we will end today's webinar.
I would just maybe summarize and say that the work on internationally educated health professionals is probably one of the fastest moving areas of policy when we look at the health policy across the country. For those of you who are internationally educated health professionals, I want to thank you for choosing Canada. For those of you who support internationally educated health professionals like N4, I want to thank you for the immense contribution that you're doing and the navigation support, the integration support, the transition support, education, and so on. And really assure you that we're all working very closely together to really improve our health workforce situation in Canada writ large. So thank you very much for the opportunity to be here today.
Thank you so much, Lee, and thank you to you, Christine Curry, for spending time with us as well and contributing to our audience. Thank you again, and we hope that we at future webinars. Thank you so much.